Welcome to the Change Life Destiny podcast, where healthcare is being reimagined one conversation at a time. We spotlight the people, innovations, and ideas moving us from sick care to self-care and from reactivity to true prevention. A place to connect, learn, and build a new future together. Get inspired at changelifedestiny.com. Let's dive in. Well, hello, everyone, and welcome back to the Change Life podcast series. I am your host, Stephanie, and today we have the special benefit of having our COO, our founder, our visionary, the mission leader, Al Pirnia with us. Al, thank you so much for taking time out of your what I know to be very busy day
Well,
to be
I want
here
to thank
today.
you for being so special. Super
Oh,
Stephanie.
well,
You're doing an
you
incredible
bring it
job
out
with
of
this
me.
podcast. Thank you so much.
Yeah, absolutely. Absolutely. So today we're going to talk about something quite different than what we have before. The focus is going to be less on our conference and what we've done in the past and a little bit more on some special benefits that I think that you in particular bring to the corporate wellness realm. So let's talk a little bit about that. You've worked with leaders and practitioners for decades, right, in this field. So, how would you describe the healthcare or the health rather in corporate America right now?
Well, unfortunately, healthcare in corporate America reflects the status of healthcare in this country, which is people are managing disease, managing dysfunction, primarily with drugs and medication. It's a very expensive approach because we're constantly spending that money addressing symptoms instead of getting to the root cause, instead of having a one-time solution and not having to keep paying for that problem, whatever it is, throughout our lives. And the expense is now reflected in the increasing premiums that everybody has to pay, the companies have to pay, the government, how much they're spending on healthcare. And we believe that we need to get corporate America involved. We need to get companies involved to understand there is an alternative approach, a solution, in our opinion, to try and stop this increasing cost of healthcare that literally is bankrupting everybody.
Right, right. We'll get to that in a minute. I definitely want to touch on some of the biggest health challenges that you're seeing specifically with CEOs and executives, both physically and mentally. What are you seeing in the business world these days?
Well, I mean, executives, whether they're CEO or another kind of an executive, they have a lot of work. A lot of them are very much overwhelmed with the amount of work they have. They've got a lot of stress. Sometimes they're not sleeping enough. Many times it's affecting their personal lives, their marriage, their kids. So it's a combination of not eating healthy, having stress that sometimes leads to behaving in a way that disrupts relationships. And then as time passes, a lot of people, as we can see, are starting to have cognitive issues, their ability to focus, their ability to remember, their ability to just be as good as they were when they first became a CEO. So I think there's a lot of issues on at the executive level, from just the lifestyle to the impact that their neurological condition can have in their ability to maintain their position.
Right, right. So then how does that affect the companies that they're leading?
Well, I mean, ultimately, it means that they'll be out of a job. I mean, if executives are burnt out, stressed out, depressed, having a terrible personal life, and not able to function neurologically as good as when they first became a CEO, they're going to be out of a position very, very quickly.
Right.
And that's a shame because with the technologies that's available now, literally all these issues can be addressed in a way that we don't have huge side effects with the drugs and medication, and many times we have better results. It's just a lack of knowledge and lack of understanding of what are the options. Our
Right.
traditional approach to healthcare is simply a few minutes with your doc, and here's a drug, and that's pretty much it. And that's a system that basically is not really addressing the root of the problem, and it's just a financial disaster for everybody.
Right. So That's definitely how I have viewed in the last 10 to 20 years how the healthcare industry has taken care, quote unquote, taken care of issues. Do you think that there has been any sort of cultural shift in how leaders view their health compared to 10 to 20 years ago?
Yeah, I mean, when I first started many, many years ago, nobody was really open to this alternative view as to what can we do about our healthcare issues. I think what's happened post COVID is society has realized the pharmaceutical one shot approach is probably not the first step that you want to take when
Mm,
you're dealing with health challenges. And I see that with not only society at large, I see it with executives and even physicians. Everybody is realizing that there are alternative approaches and we need to start looking at those. And that's, I think, a huge, huge opportunity for society at large to start getting educated and making a decision. It's ultimately their decision. Everybody has the decision to make as to do I want to go and be managed for the rest of my life with my health conditions and the challenges? Or do I want to try and get to the root cause and try and solve this problem so I don't have to keep dealing with it throughout my life?
right, right. So, how do you, additionally to that, how do you see the corporate wellness entities evolving in the next 5 to 10 years? What do you think the roles, additionally, of technology, devices, and functional medicine? What do you think their roles are going to be in the next 5 to 10 years?
Well, before I answer that question, I think it's important for people to understand what is typically going on in corporate wellness today.
Yes, that is
Uh,
important.
there was a study that got published a few years ago that basically said that $8 billion in corporate wellness is a total waste of time and money.
Mm,
Primarily because what corporate wellness has been doing for years is doing a lot of testing on their employees, trying to get them to understand, hey, you've got some issues here. You're pre-diabetic. You don't want to become a diabetic. And after the testing, what they typically do is they throw information at the employees. And at best, some companies will contract with these third parties and provide some kind of counseling. They call them a health coach, but they're really more people trying to motivate the
mm,
employees to take action.
hmm.
But they're leaving it really up to the employees to figure out what to do. And that study that got published a few years ago that said here's $8 billion of money being wasted because nobody's really doing anything with that information. A very small margin of the population is actually taking steps to address their issues. So
Right.
for the vast majority of the employees, they go through these tests, they have somebody that throws information at them, and they pretty much just don't do anything. That's the fundamental problem right now with corporate wellness, and that's a shame because there are so many ways that we can take this step beyond that just educational part of hey, you've got prediabetes and you should figure out what to do with that condition so you don't become a diabetic. There's so many things we can do beyond just information. The technologies that's available now in terms of helping people is quite immense. And that's where I think corporate wellness has to evolve. It has to evolve to where we're going beyond just throwing information at people, but providing the tools and the programs and what we can do to help people address their issues. Now, the issues can range from something as really problematic as being a pre-diabetic and then becoming a diabetic and
Hmm.
for most people having to go onto medication, to trying to get to the core of why sometimes these problems are arising in the first place.
Mm,
Sleep, stress, all these factors, obviously food habits, have a huge impact on why people become a diabetic. So being able to go beyond just throwing information, but giving them programs and devices and what they can do to start addressing some of the core issues as to why they're becoming a diabetic or why they're pre-diabetic and trying to reverse that condition is the way that I think corporate wellness has to go.
yeah, can't agree more. And giving them the tools that people will actually use that are simple enough for people to actually use. As you were speaking, I was thinking about, okay, well, what are these people called? These health coaches that are hired for this sort of old burnt out system that is clearly not working. It's almost like a motivational listener.
That's right. It is.
It's not somebody who is going to, they're going to try to motivate you, but really their main job is to listen. And oftentimes they don't have all of the tools in their toolbox in order to really make a difference. Okay, so something that most business owners don't know about is this IRS backed tax credit for wellness. And I know you know a lot about that. So can you explain what that is and how it works?
Yeah, it was part of Obamacare, and it's embedded into the tax code, and I don't think it's going to change anytime. Once the tax code changes, it seems like nothing will make a difference. They're not going to change that. It's there, and it's unfortunate because I've talked to hundreds of people, and I haven't come across anybody that seems to know this tax credit exists. I
Hmm.
think part of the problem is that because there's no money being made, the brokers don't make money promoting it. Accountants, are creating a lot more work for themselves to help these companies implement it, even if they know it exists. And most of those who I've spoken to don't seem to know it exists. So the first problem is that the vast majority of corporate people, executives, don't understand there is this credit that they can take advantage of that literally gives them found money.
Mm.
And what's really great the way it's set up is that you don't have to wait for the IRS to send you a check. You can literally go into your payroll system, enter a few codes, and start taking out of the contributions the company is making to that employee's FICA and paycheck.
Oh,
So it's a very simple thing to implement. The requirements are very basic, and there is no effect as far as the net pay to the employee. That they don't see any downside as far as that's concerned. And there is no net loss to the company in terms of having a cost to doing this. So it's a true win-win for everybody. The government set this up so that companies are incented to try and get their employees to start becoming proactive with their health, which is fantastic. But unfortunately, nobody seems to know it exists. They don't know how to implement it. And that's one of the things we're trying to address by working with companies, showing the executives how simple it is to implement and how much money they can literally go and access and hopefully spend it on themselves, their employees, and their families, and get them to start understanding this alternative approach to healthcare, which is let's try and address imbalances before disease conditions set in. Because once that disease condition is set in, it's become so much more complicated to address versus trying to correct that imbalance at that earlier stage.
right. Okay, so these companies, are there requirements? Are there things that the companies have to do? It does seem like it is another one of these systems where you do have to do a couple of things, but it also sounds like you might have a solution as to what to do once that box is checked to say, yes, we're going to take advantage of this tax credit.
Yeah, I mean, like anything, there are requirements, but they're very basic. What we've done is we've partnered with a company that does all that work, so the organization has nothing, no heavy lifting to do the work themselves. And that's one of the exciting aspects of this system that's there is that we just explain to the company exactly what we're going to do and then show them how to do it within their payroll system. And once that's done, they can start taking the money out. And it's not a question of waiting for somebody to send you a check. They can take
Right.
the money out, and it works out to $500 per employee per year.
Well,
Um, the requirements are quite simple. The only requirement that the company has to fulfill is to have every employee complete a symptoms questionnaire that gives us a sense of what's the status, the health status of the employees. And after that, they just have to agree to receiving either a text or an email message that will give them some insight as to how to, make better healthy choices in their lives. And that's really all it is. As long as the employee does not opt out of that system of accepting email or text messages, the company can go ahead and continually take this tax credit of $500 per employee per year.
So, okay, that can add up. That can add up for that company. It seems like it could be a really significant change and difference to the company. So, tell us how you, in your vision, have connected the dots in between. Okay, we've found this money for you. Now let's tell you about something that potentially you could use for yourself or your employees to increase that awareness, or at least the opportunities for better wellness within their company.
Yeah, that's a fantastic question, and that's the crux of the issue, Stephanie, because you can throw money at people, and if it's not utilized correctly, efficiently, to get to the root of what you really want to address, then we're all wasting our time.
Right.
And that is one of the problems with corporate wellness companies today. They don't really come in with programs that's going to have a huge impact on people's lives and getting them to understand what they need to do to address some of the issues that they need to address. So we've developed three programs that we introduce to companies once they have this money, this found money. And we believe these three programs, covers the gamut of what society needs to understand about becoming proactive with their health. The first one is what we call the Changing Life and Destiny Expo. And as you know, we have a conference every year in Dallas, the end of April, where we showcase 100 technologies to functional medicine practitioners. And these are technologies that can reverse aging, they can restore health, they can promote wellness, prevent disease. And the idea is to get practitioners to learn about these technologies, decide which ones they want to take back into their clinic. So what we want to do is we call that event is called the Changing Life and Destiny Conference, and what we want to do is provide a mini version of this to the employees of these companies. So we've designed a concept called the Changing Life and Destiny Expo, where we bring 35 either health and wellness professionals or technologies, and say at lunchtime, give the employee pool a elevator pitch on each one of these, so that people can start understanding this incredible alternative world that exists around this idea of let's become proactive with our health.
Hmm.
And after 45 minutes, 50 minutes of presentations by 30 or 35 of these practitioners, professionals, and technologies, people go and find who they want to talk to. Those elevator pitches triggers people's interest and gets them excited. Oh my gosh, what's this? What's that? And it really gets people to start understanding the scope of what's possible beyond just let's take a medication. So that's one of the programs we offer companies once they start having this found money and trying to decide where we're going to use it and how we're going to use it. The second program is what we call the Wellness Priority Kit. And the purpose of this is to introduce to employees a whole array of products that can replace over-the-counter medication for things like sleep, constipation, focus, anxiety, depression, stress. There's so many over-the-counter medication people are taking. Many times the natural ones are more effective, but most importantly have no side effects.
Mm.
And we really feel that there is a huge need for people to just stop taking medication over medication and having all these side effects and taking more medication. And this is one way to do that. The other aspect of the Wellness Priority Kit is to ensure that people are taking all the nutrients the body needs, the minerals, the superfoods, the B vitamins, the D vitamins, all those things that the body needs to really perform at a level that is going to provide homeostasis and the ability for the body to function, take care of itself, ensuring healthy immune function. I mean, if we have a great immune system, we can't get cancer. There's so many benefits to having a healthy immune system, but there's ways to support the healthy immune system, and there's where we destroy the immune system. So this Wellness Priority Kit is meant to address all those issues. Again, that's something that could have a huge impact in
Mm.
terms of a society being proactive again instead of waiting until something happens and then taking medication for the rest of their lives. And the third program is something that we've been offering practitioners for decades and has incredible successful track record that is so simple to implement and gives people control over blood sugar and body composition. And those are the two main drivers of disease in this country: elevated blood sugar and healthy body composition.
Mm.
And if we just take those three programs and nothing else, we could literally have a huge impact on our healthcare system and do it in a very cost effective manner.
Wow. Okay. So three solutions that you would present to a corporation to allow them to connect the dots in between. Okay, you found this money, here are some options of what you can do, because my goodness, if they have employees or themselves for that matter that are feeling better, have less disease condition that they're working with, then everything improves, I can imagine, at that corporation.
Everything. I mean, if you look at the number of 6 days, the productivity, just the goodwill that you can create with people feeling better, being more alive and excited about life, being able to address some of their stresses and their personal issues, just having enough sleep, just being
Mhm.
able to address some of their anxiety. There's so many tools that we can use to help people. It will have a huge impact on that company
Yeah,
in so
absolutely.
many different ways.
Absolutely, absolutely. So let's go back to the CEOs a bit and these executives, because I've heard you say it before, the CEOs and the executives, once they understand these opportunities, and that's a great thing for their employees and for their corporations.
Mhm.
But what about them? So tell us a little bit about your vision for the executive wellness retreat.
The Executive Wellness Retreat is a 2 day event. We have our conference for our functional medicine docs in Dallas once a year, which is a 3 day event. The retreat for the executives is a 2 day event. And we've done this a couple of times, been very successful. Everybody said, oh, this is, they really enjoyed it. The first day, we only have presentations, and they were typically short presentations, 15 to 20-minute presentations on about 20 to 25 technologies, cutting edge technologies that most people don't even know exist. Even practitioners who are doing functional medicine who work with us, many of them don't know about some of these technologies. So the first thing we want to do is educate them, is look at what's out there, look at what's possible. And then the second day, the main purpose of the second day is for them to experience a lot of these technologies and get tested. There's a number of tests that we think is very valuable for an executive to have, and it's truly valuable for anybody to have, but especially executives, because one of those tests is a brain map. We map 19 points on the brain. And what's amazing with this brain map, it gives you so much information about what's really going on inside the person's brain that's potentially affecting behavior.
Mm.
Now, the behavior can range from memory issues, focus issues, addiction issues, anger issues. I mean, depression, all these things show up in the brain. And what's really great is that, if you have this information but you can't do anything about it, obviously you're wasting your time.
Right.
But what's really great is that you can fix this. I've actually done this myself. Many, many years ago, I had a brain injury and I started noticing I wasn't as articulate, and my memory was affected. And by chance, I came across this technology at a conference and I started having it set up at our clinic, and I started going through it, and it changed my life.
Wow.
It literally saved my life, I believe. So I believe that every executive, the first thing every executive needs to do is a brain map, and have somebody who knows how to read that brain map explain what's going on inside that brain, and how, if there are issues, how we can fix it. And fixing it is a combination of either neurofeedback, neurotransmitter balancing, and supplementation. It's very easy to do all three of them. It's not complicated. It's not even expensive. But the results is you can take a failing marriage and make them successful. You can take a failing student, make them an A student. You can take somebody who is out of control and put them back on track. It literally can save marriages. It can save a family from disintegrating because of what's going on. And obviously, in the executive side of things, it can ensure that that executive is on the job for a lot longer than they typically be on that job.
Yeah. Oh goodness. I mean, that's huge because not only do most CEOs and executives have some sort of underlying foundation of stress and anxiety simply because of what they are choosing to do with their work, that affects all of those other areas that you were talking about. So, being able to have an assessment like that and then solutions that can help is huge. That's amazing. What other health systems would you say are addressed at these retreats?
Well, I mean, we obviously look at the neurological function, we look at the metabolic system, we look at the DNA. There's a wonderful technology that literally any company could set up in their home office at their facilities to help with lymphatic drainage. You know, the lymph is such a crucial piece of the immune system.
Mm,
It's where we can detox the body, but unfortunately, with the lifestyle, the toxicity, just everything all put together, our lymphs start clogging up,
mm,
and they can't detox, and that's incredibly important. We see how many people, 1 out of 2 people, are getting cancer. Well, one of the core issues is if you can't detox and these lymphs are clogged up, that is one of the consequences is for the body to not be able to take care of itself. So having a simple technology that could literally be implemented in the corporate setting, obviously in clinics, even in homes, that not only gives the body the ability to start getting the lymphs to flow and detoxing, but in the process, having amazing relaxation that
mm.
helps with stress and anxiety and depression and ensures that you have much better sleep. You have a combination effect there that is priceless. So,
Absolutely.
having these kinds of devices that you can either put into the corporate world, you can take it home, or you can go to a clinic. These are the kind of technologies we want these executives to understand exist that can not only help with your immune function and the detoxification, but just experiencing it alone will help with sleep and anxiety and stress and all those issues that a lot of corporate people are experiencing.
Right, right, absolutely. And I can imagine that you also are incorporating maybe products, services, devices that help with heart health, maybe other things that maybe be top of mind for a CEO, an executive who is under that much stress.
Well, heart disease is probably still one of the top killers in America. And again, it's such a shame because we will have a test at the weekend retreat that is incredibly accurate to show what's going on with the arteries. And it's non invasive, inexpensive. Anybody could pretty much access this. And again, what's important with these tests is that it's one thing to say, okay, you've got blockage, but the question is, well, what do I do about this?
Right,
And that's where the technologies and the programs that we're showcasing. It's not just about saying, hey, you got this problem, goodbye, thank you, and
sorry
you
for
know,
your loss.
good luck. But we actually give them the solutions
Right.
of what to do with that so we can solve the problem. So we're going to be doing a heart test. We're going to be doing a brain test. We're going to be doing a liver test. Fatty liver is a huge problem. Huge, huge problem. People originally thought it's just because of alcohol consumption, but with all the sugar that everybody's taking in and the kind of food we're eating, there is an epidemic of fatty liver. And the problem with fatty liver is that nobody even knows they have it until it's too late.
Right. Right.
So, having a test that shows you've got this situation and having a solution to fix it is priceless. These are the kind of tests that we're going to be providing at the weekend retreat. And the ultimate goal of this retreat, to be honest with you, Stephanie, is to get CEOs to understand how crucial it is for them to step up
Hmm.
and become part of this movement to get society to understand we as a nation have to become proactive with our health, not reactive. This reactive model is literally bankrupting everybody. And we have to go down this road of being proactive. All the technology is there to get people on that road. And what we're telling these CEOs is that you have the most to lose. If you want this country to have the opportunity you had for your kids, we have to address healthcare costs, and that is not going to happen if you don't get involved. Because we're working with these practitioners, they're doing these one-on-one consults, but if we really want to move the needle, we got to go to the masses, and that's the corporate world, and the CEOs need to get involved and not just delegate it to their HR, but to get up and stand up and say, we as a nation need to make some changes. Here's the money, here's the programs, and I really want to help you guys go down the right direction to address the root cause of your problems and become proactive with your health. If they get involved, we really have an opportunity to change the direction of healthcare in this country.
That's the momentum.
Yeah.
That's the momentum right there. That is the buy-in to assist and do what they can in the position that they have to really make a change. And thank goodness that you are here and that you have this vision and that you have this mission. One of my next questions was what is one thing that you would say? And I think you just said it. You just said it so beautifully. And people that are listening really involved understand what is being brought to the table for you here and how systematically this can work within your corporation. I bet you're going to find that there is so much good that comes from it. So if somebody is wanting to learn more about these programs, about these three opportunities, about anything else that we're doing, we're going to drop in all the links in the show notes, of course, as we always do with our podcast. But Al, if there is just one other thing that you wanted to say, just one other thing to get these folks to understand how important it is, what would it be?
I just, for if we're talking to our CEOs, I would just think of your legacy,
Mm,
what you want to leave. People remember not how much money you made, but what impact you had on society. And I think the biggest challenge right now this country faces is healthcare.
mm,
And when you look at what could potentially happen with people not being able to afford their health premiums, their catastrophic health challenges, it's just heartbreaking.
yeah.
And I really think that the legacy that we all can leave is to try and help society to become aware of what's possible. And at the end of the day, they can decide where and how they want to go with their health. But I really believe that the CEOs can make such a difference here. And I just invite them to come to our weekend retreat, get yourself educated what's possible, first and foremost for yourself and your family, but then for what you can do for your employees, and then decide if it makes sense or not.
Yeah. I love it. I love it. I think it's a beautiful mission, a beautiful vision, and something that I know that you are always desiring to make better for everyone involved. So, Al, thank you very much for being here today and sharing your vision with us. And again, if you are listening and you want to know more, go down to those show notes. There will be links there for you. And everyone have a fantastic day. And let's do everything that we can to be proactive together.
Thank you, Super Stephanie.
You're welcome, Al.
You're super.
That's a wrap for today's episode of the Change Life Destiny podcast. If you loved what you heard, share it with a friend and follow us for more bold conversations and breakthrough ideas. Ready to take the next step? Visit changelifedestiny.com to join the movement. See you next time, and keep diving in, learning, and leading the change.